The more a person would pull their hand towards a tucked-in position from an extended position, the more you would stimulate a grasping movement. Simple. Hello, welcome, and kumusta? Thank you for joining me. This is How, your occupational therapist, and welcome to OT Conversations. In this episode, I'd like us to have a discussion about the sequence of prehension patterns. So your therapist, your occupational therapists, and most of you will be working with people, and you'll have to do upper limb motor retraining, whether it is because of a stroke or a neurological condition, or because you are improving somebody's prehension pattern because you're working in pediatrics. It is always important, it's always good to know what the sequence of prehension pattern would be. This is so that you can expect what will happen when you're doing your therapy and you know where to start. At first, if you think about it, a child's hand is just naturally fisted. And there is a lot of flexor tone in there. So when somebody's had a very bad head injury, for example, it can assume a flex tone. It's either that or extremely flaccid and there is no movement at all. But if you are doing the retraining, you wanted for the person to be able to use their hands, obviously. And how do you want to know, or how do you assess the use of hands? First, ask them, can they reach? That would involve looking at somebody's ability to put the distal part of their arm, which would be the hand, in a place where they wanted it to be. So that's a reach. And then the next thing, can they actually move their hand at all? If they cannot move their hand, then you'll have to assess what kind of prehension pattern does the person have, right? So let's start from, say, the person cannot do anything and you wanted the person to build up on their prehension pattern. So the first thing that you need to do is you need to stimulate that hand if it is flaccid and it is, say, just open. And what you need to do is you need to stimulate that finger movement. The natural tendency is for those fingers to do a flexion movement, so a grasping movement. So that would be the first thing that you need to do. The first thing that will come back in terms of the mass grasp would be that of a hook grasp. And if you want to know what a hook grasp is, imagine if you are carrying a shopping bag or an attaché case with the fingers. So your fingers are hooked in a way where the metacarpophalangeal joints, the MCP, are extended. The proximal IP joints and the distal IP joints are the ones that are flexed. So there are no movements of the thumb in here, but it's all four fingers. So that would be a first thing that you need to stimulate. So that is a hook grasp pattern. And how do you stimulate this? You can use tactile stimulation. You can do quick stretches of the intrinsic muscles of the hand. And you just quickly tap it and then stretch it very quickly and get the person to almost do a hand wrestling with you or finger wrestling with you. If you do a hook grasp against a person's hook grasp, that would stimulate the hook grasp. That would be the first thing that would come back, and you wanted the person to stimulate that. Now, after the person has demonstrated that they can do that, what you need to do is you need to teach the person to relax their hand so that you can stretch it open. Remember, when somebody's relaxing their hand willfully, it is also a retraining. You're also teaching a person to use the hand. Relaxation is a function as well. So when you relax, you don't move, because there is a balance. Every time you move the hand, there's a balance between relaxation and contraction. Hook grasp would be the first thing that would come back. That's what you would want to stimulate. The next thing that you would want to do would be a spherical grasp. No, I'm sorry. It's cylindrical grasp. So cylinder. So this time around, there is an involvement of the thumb, and it assumes a cylindrical position, just like you are handling a cylinder or a small can. So yes, you can just have a cylindrical grasp. So that is much more higher level. And it's the same thing. If you want to stimulate those arms, the hands, and if you want to stimulate the strength and the grasping, you just have to carry on doing that. Use some of those flexor patterns. The more a person would pull their hand towards a tucked-in position from an extended position, the more you would stimulate a grasping movement. Simple. After the hook grasp, it will be followed by a cylindrical grasp. And after the cylindrical grasp, the next thing that will improve will be a spherical grasp. This time you are involving abduction of the fingers and combined with flexion as well. So when you're carrying a ball, that would be a spherical grasp. Those are the three very basic gross prehension pattern that needed to follow. Okay, so just to remember and just to remind you, the first one that would come back would be a hook grasp, followed by the cylindrical grasp, followed by the spherical grasp. Now, if you want to strengthen the grasp, the gross prehension and the grasp, now when it comes to the grasp itself or to the mask grasp, there are two types of grasps: the power grip, and then the second one would be the precision grip. A power grip is a mass grasp of the hand, but this time there is a lot of involvement of the ring and the little finger, just like you pulling a rope. Imagine that when you're doing a grasping movement and you need to pull on something. When you want to do a power grip, it is the little finger and it is the ring finger, and actually will have an involvement on the middle finger as well. A lot of movement and pressure and strength is coming on the ulnar side of the hand. That is a power grip. So that's one thing. If you want to enhance that strength of the hand, then that's the one thing, that's one prehension pattern that you would want to stimulate. Power grip. The next thing would be a precision grip. A precision grip would be a grip where there is a lot of movement that is controlled by the thumb and the index finger and the middle finger. That would be a precision grip. All right, so two types of grip. The power grip, that's the one that you need to stimulate first. You can do some activities like pulling ropes or pulling therapy. So you do it in that respect. And then the next thing that you would want to do is to do some precision grip as well. So there you go. That is the sequence of gross prehension pattern. So the next thing now is, once you've done some exercise and activities with the gross prehension patterns, then you need to do the fine prehension pattern. And what would be the fine prehension patterns? The first one that will come back will be a lateral pinch. A lateral pinch would be the thumb pressing against the side of a bent index finger. So again, this one will tie up with the hook grasp. So imagine if somebody's had a hook grasp motion or movement, like the distal part, the proximal IP and the distal IP are bent, just like a monkey. So the thumb is actually floating. And what you can do is you can do some pinching movement where the thumb now begins to adduct and press against the side of the index finger. And that is now the first fine prehension that would come back. If you have a key, that's something that you would do. You can press, pinching. That would be something that you would be doing. fine prehension pattern. And then you can use that when you are picking items, or use the side as well. So that is lateral pinch. The next thing that would come back would be a tripod position or tripod pinch. And this involves the thumb pressing against the palmar surface or the distal pad of the index and the middle finger. So that would be a tripod pinch. So you can use that for picking a few things. That would be the next sequence in your repertoire of retraining. After retraining the lateral pinch, you do a tripod pinch, meaning there's 3 fingers in there. Next thing that can happen would be you can use the pad to pad pinch. So pad of the thumb and the pad of the index finger. So you can do that when you are picking items, just like holding onto a piece of paper. There you go. That is a pad to pad pinch. And normally this would be expected, and a person should be able to do this when a person is around 10 months old. Okay, that's pad to pad. And then the last prehension pattern that would come back would be the tip to tip or the pincer grasp. And this would be the tip of the thumb and the tip of the index finger. And you can have tip of the middle finger, tip of the ring finger. But for functional use, it's usually the tip of the index finger. That's what we use for picking fine items. So that's the sequence. Again, after the gross prehension pattern, you need to go and do the fine prehension pattern. And with that, the sequence would be lateral pinch, which would work alongside with the hook grasp. Then you can go with the tripod pinch, which is around 7 months, pad to pad pinch around 10 months old, and then tip to tip pinch. That would be it, guys. So these are all the prehension patterns. Now, there will be some in-hand manipulation skills that a person will have to be doing. I haven't had a lot of work with in-hand manipulation skills because most of the sessions that I have in the acute phase is usually on the gross prehension pattern and the fine prehension pattern. And I remembered back in the days around 2001, and when I was working in some stroke units in the Republic of Ireland, I would encounter some of this in-hand manipulation skills because I have time to do that. In a rehab facility, you can do this. You can take time and you have the ability to work with a patient on this ability. So if you want to refine the skills on this, then you do in-hand manipulation skills. And what you can have is that sliding, really, which involves you holding a coin, for example, and then you slide the coin along the shaft of the finger, of the index finger. So it'll be your thumb that will be controlling it, or you can use the index finger to control it as well. So that would be sliding. And then the other one would be the in-hand manipulation skills, where after that sliding, you accumulate items in your palm, and then you, one by one, you take it out and you pick it out and you bring it to the tip of your finger. Or what you can do is you can collect items and coins with your finger, and then after collecting it, you can actually accumulate them in your hand as if you were picking plenty of coins. So you do that coin picking and then leave it in your thumb, in your hand rather. Okay, guys, there you go. It's very straightforward. We have just had a discussion about the sequence of dexterity retraining, or the sequence of gross prehension pattern and the sequence of fine prehension pattern. If and when you do your retraining, just remember, start from gross prehension first, coming into fine prehension. From gross to fine, that would be the sequence of your sessions, and that's what you should get the person to that level. Just be mindful as well, because this is a little bit high level when you're doing this retraining. You cannot just have a session for somebody who just couldn't reach and can't do anything, and all of a sudden you'd be expecting them to do the grasping and the fine motor control skills. Those are very difficult to do. And with the hand, you need to have a very strong proximal control as well. So you can do your upper limb retraining. And if you do your upper limb retraining and you focus on dexterity, but if you do not have that ability to reach or to actually move the hand in space, like the pronation, supination, that is impaired, then doing the hand and the hand retraining will be very difficult. Then that hand should just be used for stabilization at first. Because when you're doing it with stabilization, how does that work? It just meant that you are getting the person to open their hand so that they can press on an item and keep it in place. That's another sequence of upper limb motor retraining. But then for this episode, we just talked about the distal retraining. We talked about the gross prehension pattern and the fine prehension pattern. Okay, there you go. I hope you enjoyed this talk and this conversation. Just remember, guys, anything you do matters and has an outcome. Talk to your friends about this, have a discussion, learn together, be mindful of your practice. Enjoy occupational therapy, enjoy learning. Until next time.
If you enjoyed this podcast, talk to your friends and colleagues about it. Like it, subscribe, share, and do what you can to appease whatever algorithm that is at play. Just remember, guys, anything you do matters and has an outcome. Until next time, bye!